Bismillahirrahmanirrahim. Assalamu alaikum. My name is Hafiza Laiba Khurshid. My roll number is BP1650073. My group number is 6. The topic given to our group is End of Life Care, and the subtopic that I have chose from it is Hospice Care. So, what is end of life care? It means care provided to individuals who are near to death, means the final stage of life when death is near. End of life care can refer to physical, psychosocial, and spiritual care provided to patients and their families. It may last minutes, hours, or weeks, means unpredictable. End of life care refers to both hospice care and palliative care. Hospice care. It is a place or home providing care for the terminally ill patient, means who are near to stage where death is expected. They are expert in medical care, pain and symptoms management to provide emotional and spiritual support to the patient and their family. It is based on team-oriented approach to end-of-life care, or it can be provided in any settings. Purpose: to optimize the quality of life for the patient and family in the last weeks and months of life. Hospice care prioritizes comfort and quality of life by reducing pain and suffering of patients who are facing a life-threatening illness. So one of the conditions that needs hospice care is end stage of Alzheimer's dementia. It is a topic of my case study. So first we have to know about Alzheimer's and dementia. Alzheimer's is a specific brain disease that accounts for 60 to 80% of dementia cases. And what is dementia? It is a general term for symptoms like decline in memory, reasoning, or other thinking skills. So we can say that Alzheimer's is a type of dementia or one of the most common cause of dementia. End of life care needs of people with dementia. As the disease progresses, the patient may feel the patient may have to suffer from communication problems, loss and bereavement, pain, and other symptoms. Case history. MB is an 89-year-old woman referred to hospice for end-stage Alzheimer's dementia. She lives in a residential care home for elderly. Her past medical history include osteoporosis, coronary artery disease, COPD, hypercholesterolemia, and hyperthyroidism. She is not oriented to person, place, or date. Her speech is nonsensical. She cannot feed herself. She is bedbound and incontinent of urine and stool. She is agitated at times, especially at night. Her weight is 112 pounds and her recent serum albumin is 2.2 gram per deciliter. Her current medication are aspirin 81 mg, alendronate 10 mg, lovastatin 20 mg with dinner, multivitamins, beclomethasone inhaler, albuterol 2.5 mg, acetaminophen, olanzapine 5 mg, milk of magnesia 30 ml per oral, and bisacodyl suppository 10 mg. What criteria does MP meet for eligibility for hospice services? What is the assessment of MP's medication regimen? And which medication are the hospice required to provide and which might be discontinued? Subjective. Chief complaint is of Alzheimer's dementia. Her age is 89-year-old, weight 112 pounds. Her medical history includes osteoporosis, coronary artery disease, COPD, hypercholesterolemia, and hyperthyroidism. Her current medication include aspirin 81 mg, alendronate 10 mg, lovastatin 20 mg, multivitamins, olanzapine 5 mg, bisacodyl 10 mg, milk of magnesia 30 ml per oral, beclomethasone, albuterol 2.5 mg, and acetaminophen. Objective: serum albumin is 2.2 gram per deciliter. Sign and symptom: she is not oriented to person, place, or date. Her speech is nonsensical, cannot feed herself, she is bedbound, or agitation occurs at night. Assessment: so we assess that the patient is totally bedbound. She is unable to do any activity, unable to speak intelligently, or she cannot even feed herself. In addition, she has other comorbidities. So MP is eligible for hospice because of her Alzheimer's disease. Then, because MP is to be enrolled into a hospice program, we have to focus on improving her quality of life rather than management of discomforting symptoms. Unnecessary medication should be discontinued. Acetaminophen is helpful in relieving mild pain, so it should be continued. Albuterol 2.5 mg can be continued if it improves her breathing. Alendronate 10 mg should be discontinued because treatment of osteoporosis is not important in terminal stage of life. Aspirin 81 mg may be continued to decrease the risk of cardiovascular clotting, although it will not increase MP's comfort or quality of life. Instead of dexamethasone, a systemic corticosteroid, prednisone 5 mg should be given to improve her COPD as well as her appetite and sense of well-being. Bisacodyl 10 mg and milk of magnesia 30 ml is a good laxative regimen for constipation. No need of giving lovastatin, which is cholesterol-lowering agent. Discontinue multivitamins to simplify medication administration. Olanzapine 5 mg is used to manage agitation and confusion. Thank you.